My name is Timothy V. I am working with Tom in creating these short instructional and awareness videos to help bridge the gap between the business and the need for cybersecurity in the healthcare industry. The Hipaa privacy and security rules dictate that all who may come into contact with protected health information go through a training on Hipaa policy, and that there be documentation to prove that the training has been completed. This program will train you in the basic Hipaa rules regarding the use, transmission, security, and privacy of healthcare data. The Health Insurance Portability and Accountability Act, also known as Hipaa, was enacted by Congress in 1996. Hipaa serves three main purposes. 1. To protect people from losing their health insurance if they change jobs or have pre-existing health conditions. 2. To reduce the costs and administrative burdens of healthcare by creating standard electronic formats for many administrative transactions that were previously carried out on paper. 3. To develop standards and requirements to protect the privacy and security of personal health information. Entities covered by the privacy and security rules include healthcare plans, healthcare providers, healthcare clearinghouses. Upon passage of the Hipaa Act, the Department of Health and Human Services was required to issue two separate regulations referred to as the Privacy Rule and the Security Rule. These regulations helped healthcare organizations to adopt processes and procedures to ensure the highest degree of client confidentiality. These processes include administrative, physical, and technical safeguards to ensure that medical information is stored, transmitted, in a safe and secure manner. Hipaa covers a broad scope and affects every department of every entity that has access to personal health information. Hospitals, insurance companies, medical practices and other healthcare organizations are going through significant changes in the way they handle patient information. Entities covered by the privacy and security rules include healthcare plans, healthcare providers, healthcare clearinghouses, and business associates of covered entities, which include auditors, consultants, lawyers, data and billing firms and others with whom the covered entities have agreements involving the use of protected health information. Next, protected health information, no matter what form it takes, notes on a medical chart, health information entered into a computer or discussions about a patient's condition, any identifiable health information becomes protected health information. A covered entity may not use or disclose protected health information except as the individual authorizes in writing, or as the Hipaa privacy rule permits or requires. PHI can be disclosed for the following reasons: to the individual or their authorized representative, or for treatment, payment, or healthcare operations, or when the individual has the opportunity to agree, or object such as when the patient brings another person into the exam room for their office visit, or incidental to an otherwise permitted use, or for the purposes of research or public health. Professional ethics and good judgment should also be relied upon in deciding which of these permissive uses and disclosures to make. Covered entities are required to provide patients with a notice of privacy practices and make a good faith effort to obtain a patient's written acknowledgement of receiving the notice. The notice must inform patients of the following: 1. The uses and disclosures of PHI that may be made. 2. The patient's right to access and amend their medical information, and 3. The covered entity's responsibilities with respect to PHI. The entity may use PHI for its own treatment, payment, or healthcare operations and may disclose PHI to other covered entities. Reasonable efforts to limit PHI to the minimum necessary should be taken when using or requesting PHI. Let's move on to patient access. Except in certain circumstances, individuals have the right to review and obtain copies of their protected health information. Personal representatives, parents of minors and others may also be legally authorized to make healthcare decisions on behalf of patients. Covered entities may impose reasonable, cost-based fees such as postage and cost of copying for PHI request. Other uses of PHI. As a general rule, covered entities may not use or disclose PHI for any purpose other than treatment, payment, and healthcare operations without the patient's written authorization. The privacy rule does allow for incidental disclosure of PHI as long as the covered entity used reasonable safeguards and adheres to the minimum necessary standard. For example, the use of waiting room sign-in sheets would be considered incidental disclosure of PHI. Now let's move on to administrative safeguards. Since many employees receive, store and transmit PHI as part of their daily routine, the privacy rule requires the following safeguards. A privacy officer must be designated for the following purposes: developing and implementing privacy policies and the receiving of complaints. All workforce members must be trained on privacy policies and procedures. Requires all business associates must confirm that they will protect PHI. A system must be developed to track who accessed what information. Rules must be implemented for addressing violations of privacy, security, and transaction regulations, and establish a process for making complaints and preventing retaliation against anyone who reports a Hipaa violation. Now let's discuss safeguards for security. For administrative safeguards, the requirements include the following. 1. Designating a security officer in charge of developing, implementing, and evaluating security policies. This may be the same person as the privacy officer. 2. Ensuring computers are secure from intrusion. 3. Applying appropriate sanctions against employees who fail to comply with Hipaa policies. 4. Implementing procedures to regularly review records of information system activity. 5. Developing a plan for granting and limiting different levels of access to PHI, including clearance and termination procedures. This includes security checks and special training for all employees with access to sensitive information. 6. Providing a contingency plan for responding to system emergencies. 7. Implementing procedures for reporting and dealing with security breaches. Physical safeguards. The security rule also requires a number of physical steps to ensure that PHI contained in computers is protected. A facility security plan should be developed that deters intruders from accessing areas where PHI resides. Guidelines should be established on how to handle sensitive information that may be displayed on computer screens. The safeguarding of information on hardware and software must also be utilized, as well as procedures for off-site data backup. Technical safeguards. The security rule requires certain technical safeguards for PHI. The following controls must be in place. 1. Controls to ensure that access to sensitive information is available on a need-to-know basis must be established. 2. Audit controls to record and examine system activity. 3. Controls to help ensure that health data has not been altered in an unauthorized manner. 4. Controls to ensure that data is sent to the intended recipient and received by the intended party, including the use of passwords, PIN numbers, and encryption. 5. Controls to protect PHI sent via email and fax. According to the security rule, it is permissible to use the internet to transmit PHI. An acceptable method of encryption must be used and appropriate authentication procedures followed to ensure correct identification of the sender and receiver. Faxes are not considered to be covered transactions by the security rule. Finally, let's discuss compliance and enforcement. The Hipaa regulations are now completely in effect, and failure to comply with the Hipaa privacy or security rules can lead to significant financial and other penalties. Civil and criminal penalties to both individuals and companies may be enforced and include fines up to $1.5 million and 10 years of imprisonment. It is important that all who may come into contact with PHI understand and carry out their responsibilities under these rules, as outlined in this training program. Please be sure to answer the questions in the back of the booklet and then sign and date it. Please tear it from the booklet and give it to the reception for the records. The second part of the presentation will be to cover the general user computer policy and then a bit about security awareness. Please let Tom know I did a good job. He was thinking about replacing me with someone with a British accent. LOL. I am completely out of time. I hope you found this video informative and I hope to see you next time. Thank you and remember, Tom knows security.